Hello and welcome everyone to How to Save the Planet, a series of live talks from Friends of the Earth. I'm Louisa and I'm going to be hosting tonight's talk. And we're covering a topic that we've been getting a lot of requests for, which is the campaign around getting cleaner air. So we're joined by two excellent guests, Jenny Bates and Rosamund Adoo-Kissi-Debrah. Jenny is an experienced campaigner with Friends of the Earth working on climate, transport and leading on air pollution. And Rosamund is a World Health Organization advocate for health and air quality, the executive chair of the Ella Roberta Family Foundation, and a clean air champion for Every Breath Matters, among many other things. I'm sure you're all keen to hear from Jenny and Rosamund rather than me. So I will just do a little bit of housekeeping up front and then we'll get started. We're going to start from hearing from our speakers for about 20 minutes, covering some of their background and what they're campaigning on, and that'll be followed by a 20-minute Q&A, aiming to wrap up by 7:45. We do have moderators checking the chat box, and they're going to be posting links to things that our speakers refer to as we go. And please submit any questions you've got there, and they'll get passed on to me to ask to our speakers as well. So you'll have a chance to submit any questions you want. There will be a recording of the event, and that will be available to watch here on YouTube following the broadcast, as our previous 3 episodes are as well. So if you haven't caught those, you can go watch those after if you just can't get enough of us. So on to the speakers. Jenny, I'm going to start with you. Can you start off by just telling us, why do we care about air pollution?
Well, I hope we all do, and hopefully more of you will after this. So we're going to talk about the impacts on human health. Separately, there are impacts on plants and ecosystems, and there's also outdoor and indoor air pollution, and we're particularly going to talk about outdoor air pollution today. So the sad fact is that air pollution is responsible for up to 36,000 early deaths a year in the UK, and that's more than alcohol or more than obesity, and it costs the UK economy £20 billion a year. There are short-term and long-term health effects from air pollution. So long-term cardiovascular disease, the World Health Organization is clear that actually it causes lung cancer. It's in the same category as smoking. There's also effects on children who are higher risk of developing asthma, whose lungs don't develop, and all sorts of things. I mean, almost every organ in the body is affected. So there are lots of serious effects from that. And also in the short term, strokes and heart attacks are triggered by bad air. And also it's the most vulnerable in our society who are affected, the elderly, the young, pre-existing conditions, and some of our most disadvantaged in society who tend to live on main roads where air pollution is worse. But also, interestingly, people in vehicles can be exposed to worse air pollution than those who might be walking or cycling along the same street. So that's something to think about. There's a link with COVID. It seems to be clear that people who've lived with bad air are more likely to get COVID, more likely to have bad outcomes. There seems to be almost an immediate effect as well. Where air pollution is bad right now, it can actually affect the way that the virus might be able to enter the body. So there's lots of things about that. And if you actually read what nitrogen dioxide says in terms of symptoms, it's a toxic gas, and it actually talks about shortness of breath and cough, which sounds like COVID itself. So that's a bit of a quick roundup about why we care about it. Maybe you'd like me to move on to the bit about how bad it is. Is that?
I would love you to move on to that bit. Yes, please. How bad is it? Well, what's it looking like here?
Well, it's bad. So this gas I mentioned, the toxic gas nitrogen dioxide, that is largely a road traffic issue. The government say where air pollution is illegal on the roadside, it's responsible for 80%. Road traffic is responsible for 80% of that problem. And in the UK, which is divided up for air quality purposes into 43 zones across the country, and 36 of them are still failing on NO2 10 years after we were supposed to meet legal limits. So they were supposed to be met in 2010, 2015 at the very latest if we got an extension. So that's pretty serious. Also on local authority level, that local authorities also have to try and meet the same level. with an objective the government set them. And we've recently did some data crunching of local authority data, which shows that over 1,000 places are failing that local authority objective for NO2, nitrogen dioxide. So that's really worrying. And air quality management areas are supposed to be set up. You can see links maybe later for where there are air quality management areas. And the other really serious thing is that the World Health Organization say that this level we're talking about, 40 micrograms per meter cubed of air, is not actually safe. They found health effects below that level, and also below the level that's set for a separate short-term requirement. So that means that we're not safe. Then the other really big pollutant is called particulate matter, PM 2.5, very small, can't see them. They get deep into your lung and into the bloodstream, and they affect more or less every organ. And they come from actually a bigger mix of sources. Vehicles are important, and that's not just exhaust, it's also the tyre and brake wear and abrasion on the road from all vehicles. So electric vehicles are not the only answer for that reason, but it also comes from other sources. The biggest source is domestic coal and wood burning, actually. So, you know, open fires, that sort of thing, but also industry and also agriculture as a source of secondary particles. They are actually agricultural ammonia forms particles. So that's a real worry. And while the UK actually meets the current standards we have to meet, European standards, the World Health Organization has much stricter standards for these particles, and the UK sadly does not meet those World Health Organization standards at all. In fact, the whole of London fails that standard. All Londoners live in air that fails this WHO standard, and many other places around the country. And the British Lung Foundation, yeah.
So thank you. That paints a fairly bleak picture. I want to just pass on to Rosamond for a second to get a bit of background from you, Rosamond, as to how you became a clean air campaigner, and and how the Ella Roberta Family Foundation began. I think you're on mute, Rosamond.
I came into this world really in 2014, in September, at the end of the first inquest into my daughter's death, because the coroner concluded, the same coroner, that obviously she had an asthma attack, but then we also realised that it had something to do with something in the air. At that stage, I wasn't really, I mean, I knew about diesel fumes, but there was really no connection really at that stage. So Ella was almost 7 when she suddenly became ill, and her symptoms, as we all talk about symptoms these days, was just a basic cold. That's how the whole thing triggered off. And one of the things we tried to do is she ended up with one of the worst cases ever of asthma recorded in this country. And I'm sure quite a few people have heard the stories whereby she was rushed to hospital about 28 times. And in between that, she would have a cardiac arrest, or sometimes she would actually end up in ICU. And all along, we knew she had asthma, but we never really narrowed it down what her triggers were. That was the issue. We thought if we can get on top of her triggers, then we might be able to control the asthma. And it wasn't until she passed away and Professor Holgate looked into her case. So what had happened was he had come to London for a lecture, and he was going home to Southampton, and he just happened to pick up the Evening Standard, as you do, and he was reading it, and he heard my story, because for some reason I'd given an interview on that particular day, and he said he knew straight away what had happened to her, because I think in the interview I mentioned the South Circular and things like that. So he said immediately he had a feeling of what it actually might be. And sadly, as you know, we are heading to court very soon again. and we will see what happens there, basically. So that's how I started to get involved in clean air. And the other thing, obviously, I'm passionate about is asthma, because we in the UK, we have one of the worst rates of asthma deaths. So the year Ella died, there were 25 other children who also died. And nobody really in 2020 should die from asthma. But let me focus on London. So London, 1 in every 10 children has asthma, and that breaks down to about 250,000 children. So quite a lot, sort of about 3 or 4 in every class have asthma. Now, the issue with asthma is what bothers me is that people don't take it seriously. They just see asthma as something, you just have a blue inhaler, you just have a bit of a puff, and that's the end of it. Sadly, that is not true. The most people that die from asthma actually have mild asthma, and we are yet to break through the ceiling. Every year, between 8 to 12 children die, and that continues. Interesting when we mentioned lockdown. So the good news about lockdown, if there is any, was that no child died from asthma, as far as we know. However, as lockdown eased, the pollution has begun to rise again. And I think this is something people need to sort of think about. Every time there's a spike in air pollution, so if it goes over a certain level, thousands of people end up in hospital with heart attacks, asthma attacks, and things like that. So that's why this topic is so serious.
So Rosamond, what is it exactly that the foundation is doing? What's the foundation asking for?
We raise awareness about the dangers of asthma. That asthma is the #1 childhood illness in this country, and there's a lot of education to be had, because if 10% of children have it, even in London, that's 250,000. So every year we do basic campaigning, things like, if you have an asthma diagnosis, then you need to have an asthma plan. You should also make sure all your medicine is in date, because one of the things is the inhalers, if it's out of date, then they are not as effective. And the fact that just in London every year, up to 12 children die is actually not acceptable. I mean, we are in 2020 and we have the worst asthma death rate in all of Europe, bar Estonia.
And in terms of, so coming back to how air pollution impacts that, and for this kind of a question for both of you then, what are the key solutions that you want to see for this issue? Like Jenny, I maybe come back to you first, is what do you expect government to do, and what do you think that people can do to take action on air quality?
Well, it is a mix of everything, all pollutants and all sources, but there's an environment bill going through at the moment, and we're trying to get the World Health Organization standards to be something that is required to be met for these fine particles by 2030. That would make a huge difference. But it's a mixture of needing on transport. You need to have vehicles on the road to be clean, but also fewer of them. So we need to restrict vehicles, old diesels and petrols being available. We need to have clean air zones, but then we also need to reduce traffic levels, and we need to invest in the alternatives to make it easy and safe and affordable for people to do the right thing and travel by other means. So that does mean reallocating some road space. And when you give more road space to walking and cycling, not all the traffic that was on those roads appears somewhere else. Traffic does disappear, just as if you actually build new roads, new traffic appears, and that's very well accepted by the Transport for London and DfT. So we have to make more space for the good things, and a lot of European cities are doing great stuff, and that's the sort of thing that will help everybody to be able to breathe cleaner air.
And Rosamond, from your perspective, the campaigning your foundation's doing, like what are the big changes that you'd like to see in terms of particularly with air quality?
Well, definitely, as Jenny mentioned about the WHO standards, they actually need to be enshrined in law. And one of the things I'm also pushing for is at the moment, due to COVID, we spend 98% of our time indoors, and indoor air pollution is at least 7 times more dangerous than outdoor. So as we are beginning to spend more time indoors, we need to look at the things that causes the air pollution. We can't control what is going on outside. As individuals, we can do our bits, but indoors, things like wood burning, and I'm mentioning that as it's getting colder now. And for me, that sort of triggers me off as well. So wood burning stoves, and I don't actually agree. I mean, some people say there are cleaner ones. I mean, it depends. If you live next door to someone with a lung issue, a cleaner won't really matter, because if you look at the smoke that goes out, and also cooking is one of the sources of PM. So it needs to be our houses basically need to be well ventilated, and every time you actually cook, you need to put on the fan. You'll be amazed. See, because we have monitors inside the house, we can always measure the PM and stuff when, for instance, we are cooking. And as I said to you, it's all about education, because a lot of people do not know these things. I think I see this as a respiratory health emergency. And as Jenny said, we spend 20 billion on the National Health Service with the illnesses linked to air pollution. And if you have a child like my daughter who got ill, it can start from a young baby who goes in with a lung issue. And if they get diagnosed with asthma is not curable. So we've got this thing that air pollution can affect you from the cradle all the way to the grave. And can you imagine how much it will cost that person in medicine and what type of life that they might have? I think public awareness is really key. And if we want to put initiatives in, I think we need to explain to people why we are doing it. And I think if we put health at the center of everything we do, the public will come along with us. Look at where we are now with COVID. Everyone cares about their health. I know some people may pretend they don't. They do. I'm sure no one really wants to go out there and get COVID. And interesting, when you mention COVID, I find some of the symptoms my daughter had is very similar to COVID. Sort of you have lots of mucus, lots of shortness of breath. She got put on a ventilator. So there are quite a lot of similarities. That's why I am really, really worried at the extent and the quickness that air pollution is going back up. And I think the thing we need to all be worried about, when you look to New York, Wuhan, Lombardy, and London, they had quite a lot of deaths. And what's one thing that links to all these cities I've mentioned? Air pollution. So it is a real emergency. Jen,
thanks. And
yeah,
yes, Jenny.
I would say that the fact that air pollution went down so much when we did have lockdown shows that action can happen and can work. You know, unlike climate change, where the carbon dioxide stays in the atmosphere for years and years and years, with air pollution, if you stop producing it, you actually get an immediate result. So it really did show people that they appreciated clean air as well as bird song and all those other things. So, you know, and I think, you know, a lot of people are also caring a lot about climate change at the moment, and we've certainly estimated at Friends of the Earth that we need a cut in car miles in order to meet our climate targets. So that fits very well with what we also need for air pollution. And something like a 20. We talked about how much money it costs the NHS, 20 billion. That actually includes productivity issues as well. But the government's planning to spend 27 billion on a new roads program. You know, a lot of it new roads, not all, and far less, only about 2 billion on sort of walking and cycling. So they need to get their priorities right in terms of where we spend the money and what we want to get when we come out of building back better, is a phrase people use.
Yeah, can I just come in there about lockdown and air pollution? I think we need to be very, very careful what we're telling the public, because sulfur dioxide increased massively. There was also an issue with ozone air pollution, and PM as well, because people were still burning things. So I think we need to be very careful. the reason why we got those clean skies was because of transport. So NOx went down. But as regards to PM and sulfur dioxide, they actually went up. So I think there needs to be a note of caution, and we shouldn't get carried away. There is a lot more work that needs to be done. So, I mean, transport contributes to 65%. So you've got wood smoke, you've got construction, you've got agriculture. So there are other things also that cause air pollution, although we do admit that transport, obviously. And for me, phasing out of diesels by 2025 couldn't come quick enough. I know now, I think we're at 2030, aren't we? We started at 2040. But to me, the government, this is something they should be starting sort of now thinking about it. And there doesn't seem to be that growing back green that they promised in the beginning. I'm not sure what sort of happened to that promise, really. I don't see a lot of evidence of it. I think this is now, especially with lots of people being made unemployed, this is a perfect opportunity to introduce green jobs, to build back green. I am expecting something, but I don't see much happening. Again, it's very similar to, they made a lot of noise about the Clean Air Bill and how, I think they use the words WHO have endorsed it. WHO do not really do that. Anyone who's doing anything for clean air, they will praise them. What we say at WHO is there is no
safe level
at all, no level at all. So we admit that if you had very serious asthma and you lived on a main road, even having slight air pollution, that could, you could end up in hospital with that. There is no safe limit. So that's WHO's line. So we know, depending on the condition of people, that can affect them. Because sometimes when you give limits to people, they feel they just need to just get it just underneath it, and then everything's okay. Yeah. So that's why we've decided to say now there is no safe limit whatsoever.
Thank you. And then, so just finally, we're about to move on to questions. Jenny, I think you had something specific you wanted to say around actions that people watching can take.
Absolutely. There's Rosamond's already mentioned the Environment Bill, and people can try and lobby their MP. So we do get those World Health Organization standards into the Environment Bill. Friends of the Earth has also got an action trying to call for a green and fair recovery. As Rosamond's been saying, that's exactly what we need. So people can get involved with that. But and there's a week of action coming up next week. But also next week there's a Clean Air Day on the 8th, on Wednesday, the Thursday the 8th, I think it is. So get together with some of your allies. There are Healthy Air Campaign partners who all care about air pollution, including big charities and environmental groups like ourselves. So there's lots you can do. There's further reading. There's a podcast we've got about transport that was done recently. So there's lots that people can do, but there's everything to play for, because we can make a difference. And as Rosamond said, nitrogen dioxide went down in lockdown, and that did show the way forward. But partly because it was springtime, it was certainly not. The particulates didn't go down, and may have even gone up in places where people were hunkering down.
Great, thank you. Okay, so I'm going to move on to questions now. So we've got a few questions coming in from people watching live, and we've got a few pre-submitted. I'm going to start with a question from Barbara, who's watching currently. She asks, why are readings from diffusion tubes distance corrected to nearest fascia, which I hope I'm saying right? Is this just the UK? It doesn't give true readings for road and pavement users.
Well, I think basically what it is that if you're trying to compare the results with an annual average, which is what one normally is, if you're comparing it to the NO2 annual average of 40 micrograms a meter cubed, it has to be representative of where you would spend a year. So that's why they don't take the measurement, as I understand it, on the pavement, because nobody actually spends a year on the pavement. So they take it back to where the nearest sort of place that you might spend a year at, which would be homes or something, near the road. So that's why they distance correct the tube results back to somewhere where you would spend a year if you're going to compare it to an annual average. I hope that answers your question. There is a book full of great thick sort of technical guidance on how local authorities are supposed to do their NO2 diffusion tube monitoring. So, you know, you can always look at more detail.
And then Anna, so this is a pre-submitted question. Anna from a local Friends of the Earth group asks, with the UK leaving the EU, does that mean that the legal basis for why we need clean air zones is no longer valid?
That's another very good question. Basically, although our air quality requirements have come from the EU, we've transposed them into UK law. So those requirements for NO2 that we've talked about, they're in UK law, as are the other requirements for other pollutants. But what it means is they won't get updated. If the EU then updates its requirements, which it probably will do because the World Health Organization is updating it, then we won't get those updates unless the government chooses to. But also, this is why the Environment Bill we've been talking about is so important, because the standards we've been using in this country and in the EU for these particles, these PM pollution, has been so weak all these years that we've actually got a chance to do something better now, particularly on these particles. And actually, so if we can pin ourselves to WHO, World Health Organization standards, that would be the best, a really good sort of outcome in the Brexit situation we face.
I am sort of worried about it because during lockdown, Jenny, wasn't there an actual vote and it got rejected in Parliament during lockdown?
Well, yeah, the Environment Bill has had a first discussion, but the government probably wouldn't be making concessions at this stage. But yes, you know, there's still everything to play for to get this WHO standard into the Environment Bill, and for it to be met by 2030, as well as various other demands that us and other Healthy Air Campaign partners are calling for. So yes, there's still everything to play for.
Yeah, I think we need to stress to people it is now or never. So they need to really lobby their MPs now. So if you're passionate about this topic, because it's going to come up before Parliament very, very soon. So write to your MP and make sure you persuade them to vote in your interest.
Yeah.
Thank you both. And so possibly a question that you're best suited to answer this one, Rosamond, but question from Penny in the chat. Why are asthma deaths so high in the UK?
Asthma deaths are high in the UK for there are many reasons. Education. So we've been trying for years. So every year now, I think this was our 4th year, we do what we call an Ask About Asthma campaign. And it's to raise awareness of the dangers of asthma. And we say at least once a year, if you've got asthma, you need to go to your doctor for a review. That was actually brought in when my late daughter passed away. Everybody with asthma needs to also have a plan. So every single person with asthma must have a plan. If you don't have one, then you need to go and see your GP. And the other reason why is it's the inhaler technique. Believe it or not, I can't remember the stat, but it's quite high that a lot of people with asthma do not know how to take their inhaler properly. They actually don't. And I think the biggest thing, I actually asked her nurse about this, a senior nurse, why do so many people die from asthma? And she basically said, because people don't take it seriously. So we need to continue to raise awareness. And also, if the air pollution is high, or if people live in high air polluted areas, then they are more likely going to have things like asthma. And our air pollution in this country is very high compared to other countries like Finland or Sweden. So that all these things contribute to it. So that's the reason why we have. And people need to go to things like when we were really in the system, you then find out things like people don't show up to their asthma appointments and things like that. So all these things are really, really, really important. But we need to raise awareness and educate about the dangers of asthma. Everyone just assumes that you just take out this blue puffer and you just puff it and everything's going to be okay. Most of the time that is so, but a lot of the time And I constantly get told, I am so shocked your daughter died from asthma, because people can't believe you can actually die from asthma. You can.
Thank you. Another pre-submitted question from David, who's in one of our climate action groups, has asked, our local authority, which is Herefordshire, declared a climate and ecological emergency 18 months ago. In current circumstances, how can we encourage them to tackle air quality in a cost-effective and publicly engaging way?
Shall I come in on this first? And
I think, yeah, Jenny,
Rosamond
do you want to
can
dive
add
in
in?
first?
I mean, it's really important that we do tackle climate change and air pollution together. And it's even more important that the solutions we find are ones that are win-win, so that we don't have things that work against each other, because we need both these problems sorted. And largely the sources are the same, and largely the solutions are the same, particularly on transport, but also on things like heating and homes and that sort of thing. So there is enormous sort of co-benefit, is what they say. And the government's advisors, the Committee on Climate Change, they talk about co-benefits. And I think if you're working on climate and you can help argue that this will actually help people sort of not suffer asthma attacks, or get asthma, or die of lung cancer, or have a heart attack triggered by bad air, that will help people feel better about campaigning about climate. And equally, people who are working on air pollution, if they realise that we're actually really helping to cut climate emissions, if we have cleaner vehicles, if we have fewer vehicles, if we have better insulated homes and better heating in homes, then we're also helping the other way. So I think that's such an important point.
Rosamond, did you have anything to add to that answer?
Jenny's covered most of it. I mean, my big thing to say about local authorities, as everyone knows, is if you're trying to improve air quality, do not put schemes in that make air pollution worse, because we are in a middle of a respiratory virus. So to me, it actually makes no sense. And you need to take people along with you. Those that are affected by air pollution the most, we never get to hear from them. They are not part of the decision making. They get told what to do. So we need, and I suppose you need to give communities, especially, a chance to empower themselves. We talk about walking and cycling, and my big ask will be for cycling, for instance, to be introduced in schools, the way children swim in schools. So my own children, they've been cycling independently from the age of 10, but there aren't a lot of children in that category. And also, one of the things, whenever they go out on their bicycles, inwardly, I always panic because the roads are so dangerous. And it's now turned into a bit of, it depends where you live. So some areas, I went somewhere in North London once, I couldn't believe the amount of cycle lanes they actually had there. It was amazing. So, and also infrastructure's got a lot to do with it. So for instance, where I live, we don't have the underground, we don't have a tram, we don't have an overground, we just have a train station. So the moment that is out, then, what do you do? So a lot more needs to be invested. And I think the government need to take this matter seriously. So I think as we ease lockdown, the Prime Minister was mentioning about cycling, and there was, I think it lasted for a few days. There was something that you could get something from your GP. So all these schemes start and they just seem to die down, and no one takes them seriously. If we're very, very serious, we would need a whole culture change. And that's why I said you would need to go into schools. So we look at places like Amsterdam and Denmark, and we want to do, I call us fair weather cyclists. It's not like part of our life, because as it gets darker now, what happens? As it gets darker, it gets colder. People will come off their bikes. So maybe we need to instill it from a very young age that this is what you do. Maybe we need, a whole culture change.
Absolutely. So can I just chip back in? I think absolutely agree with Rosamund, and I would say that there's something called school streets, which quite a lot of boroughs are taking quite seriously, where they basically restrict the traffic around schools, particularly at drop-off and pick-up times, and that also encourages the schools to try and help organise how people will, to make the kids feel more comfortable about walking and cycling to school. But it is absolutely a question of you get what you build. If you build cycle lanes, you make walking and cycling easier and safe, then people will start doing it. If you build more roads, you get more traffic. So we have to put the money where we want to see the activity. So that's why it's wrong to be spending all those billions on a roads program, and we must be spending much more on the good stuff, the walking and cycling and public transport. And it has to be affordable for people. It has to be natural and easy. People shouldn't have to feel it's a problem to do the right thing. It should be the automatic thing that people do. And something like a scrappage scheme, the government should be leading on that. And it shouldn't just give people a clean or cleaner car. It should actually offer people alternatives. Like there should be a better incentive for people to join a car club, and even better ones to get instead something like a rail season ticket or a loan to get an electric bike, which can play a huge part in getting people around. So it's things like that which actually can steer the right behaviour, but without making it a problem for the people themselves, that we need to focus on.
I think also the mayor of London now, he's going to have to seriously now consider extending the ultra low emission zone now. He's going to have to, because of the air pollution. So lockdown has been, I think, just about 3 months, and already the air pollution levels are back pre-COVID levels, just like that again. So at the moment, the North and South Circular are not included in the ULEZ. And I really hope, because I remember giving him a call on a radio station once, and he said, depending on the evidence, he is open to this. And I think it's something he must seriously consider now. He seriously, absolutely.
Yeah, we've always called for that, and also the equivalent clean air zones around the country. Lots of towns and cities around the country need clean air zones.
Okay, thank you both. I think we've only got time for possibly one more question, so I'm going to go to one of the pre-submitted questions and ask. So Mary Jane asks, do you have any ideas for outreach to the non-environmentalists on this topic? Despite advice from their own experts, change at governmental level seems only to kick in when there's a substantial majority of the population calling for it.
Do you want to go first, Rosamond?
Absolutely. I think I would say, rather than talk about the environment, I would talk about health, because everybody cares about their health. I think in future, when you go to hospital, doctors should talk about it, the link with air pollution, depending on where you live. I think if you put the health at the center of it, if you look how much we've had to change our lives because of COVID. And that is about health, because we don't want to die. That's why there are all these restrictions right now. And air pollution is linked to a lot more things. I mean, it is linked to COVID. It's linked to Alzheimer's, diabetes, suicide, depression, obesity, heart attacks, asthma. So there is a lot to do to tell the public about it. There's this gap. Whenever we talk about air pollution, we always talk about the environment. We need to focus on health. Health needs to be at the center, and this will bring the public with us. So when we are putting in measures, when we are doing things, people will understand it is for their benefit. So I will forever say that health needs to be at the center. You can't talk about air pollution and not talk about health. I don't see how you can. It affects everything. And like I said, it can affect us from the cradle to the grave. And there is a gap now widening. If you live in an area of high air pollution, your actual life expectancy is less than someone who lives in a clean area. So that's how serious this is. I think that's how to win the public over.
Yeah, I would totally agree. And the Healthy Air campaign that Friends of the Earth is part of has got all the major health charities, Asthma UK, British Lung Foundation, British Heart Foundation, and others. So we need to be a partnership, all working together, and it is a health issue. So let's hope we can all get out and help fix it.
I'm going to be a little bit sneaky and try and get one more quick question in before I say goodbye to people. So could you each maybe give me just one thing that an ordinary individual can do to work for clean air? Just a quick one example.
Do not buy diesel.
Leave the car at home. Leave the car at home if you have one. Just leave it at home. Walk, cycle, do something different for a bit.
Okay. Well, thank you guys both so much. Thank you, Rosamond. Thank you, Jenny, for your time and your expertise. Apologies if we didn't get a chance to get to your questions, but obviously, please do feel free to get in touch with Friends of the Earth generally if you'd like to talk about any of these issues. And thank you to everyone that's watching and submitted a question as well. If you're also interested in getting involved with any more of the solutions that Friends of the Earth is pushing for the government to adopt in the coronavirus recovery plan, then check out our Green and Fair Recovery petition that's being linked to in the chat shortly, I believe. And if you enjoyed this talk, you can watch the previous talks on our YouTube channel, as I mentioned at the top, and you can also check out the How to Save the Planet How to Save the Planet podcast on Spotify and iTunes. And as Jenny mentioned, we had a transport episode a little while ago that may be of interest to you there. So yeah, I think Jenny, Rosamond, thank you very much. Unless there's anything else you desperately got to get off your chests, we'll wrap up.
Thank you for your interest, everyone. Thanks for joining.
Everyone keep safe during these COVID times, really. And thank you very much for joining us because, and this is on a very serious note, we need to do everything we can to keep air pollution levels low as the virus continues to surge, because there's a real link between COVID and air pollution. So lots of cycling, lots of walking, and everyone keep safe.
And think about your open fires because it is a respiratory pandemic.
Very true, Jenny. Thank you.
Thank you all. Thank you, Louisa.